morning. My name is Bidul Prentice Aubry, student at Ines Viangeri, and I'm going to make a quick presentation on applied immunology from question 31 to question 35. The first question is, what is the principle behind agglutination reaction? Then, agglutination reactions are based on the binding of antibodies to antigen, causing visible clumping of the particle or cell that carries the antigen. Mechanism. Antibodies have multi-binding sites that can cross-link antigen, causing them to clump together. This visible clumping indicates a positive reaction. Use. Commonly used in blood typing, diagnostic tests for bacterial infection, and to detect specific antigen or antibodies in a sample. As I said, agglutination reaction is just a process which happens when an antigen and antibodies are binding together. We observe some clumps, and these clumps mean there is an agglutination. So here we can have a quick example of how it works, how an agglutination happens. By here we can have, we can say that it's a bacteria, and on the cells of bacteria there is antigen. When these antigen are going to bind with antibodies, they are going to make antigen and antibody complex, which lead to antigen and antibody clumps. These clumps, that's what we call agglutination. Next question. How does latex agglutination works in diagnostic? In latex agglutination, latex beads are coated with antigen or antibodies. When a sample is added that contains the corresponding antigen or antibodies, a reaction occurs, and the latex particle clumps together. Agglutinate. Use. This clumping is visible and indicates a positive result, making it useful for rapid detection of pathogen, blood typing, of identification of specific antibodies. So, as I explained, the difference between a normal agglutination and a latex agglutination is that we added antibodies to a latex base, and when these antibodies bind with latex meet an antigen, they are going to make a precipitation or an agglutination. This reaction is actually quicker than a normal or a basic agglutination. It's quicker and it's more specific. Next question is, what is the principle of precipitation reaction is immunology? Precipitation reactions are a type of immunological reaction where antibodies bind to their specific antigen to form visible precipitates. This reaction occurs when an antigen and antibody complex reach an optimal ratio, leading to the formation of large insoluble aggregates. This principle is antigen-antibodies interaction, as I explained. Formation of precipitates. At a certain antigen-antibody ratio, large complexes are formed which precipitate out a solution as insoluble aggregates. This is the visible manifestation of the reaction. Equivalence zone. The best precipitation form when the antigen and antibody concentration are in equivalence, meaning they are present in optimal amount to form large complexes. Type of precipitation reaction. We have two types of precipitation reaction. We have single diffusion, antigen or antibody diffuse in gel forming a precipitate where they meet, or double diffusion. Both antigen and antibody diffuse from separate well in the gel, and precipitation form where the antigen-antibody complex meets. So to resume this precipitation reaction um, follows the concept of antibodies and antigen reaction. It follows the concept of agglutination. But the difference is we are going to make this precipitation reaction in a soluble, in a solution. And when the antigen and the antibodies will bind together, it will make what we call a precipitate. This precipitate will go down the solution while the remaining, the superlatant, will remain on top. Then these precipitations are going to be proportional to the concentration of antigen and antibodies reaction. Next question, how is the radial immunodiffusion test performed? Radial immunodiffusion is a precipitation technique used to measure the concentration of specific antigen in a sample. This procedure includes the following steps. Preparation of agar. Agar is prepared with antibodies against the antigen to be measured and poured into a petri dish. Sample loading. Wells are made in agar and the sample containing the antigen is placed in the center with a no concentration of antigen or control used for comparison. Diffusion measurements. The diameter of the precipitate ring is measured. The larger the ring, the higher the antigen concentration. And standard curve. A standard curve is created by using no concentration of antigen, and the antigen concentration in a sample is determined by comparing its precipitation ring size to the curve. So, in short, radial immunodiffusion test is a kind of test which is performed on a agar, on a gel. We are going to add on this gel antibodies. After adding antibodies on a gel, we are going to make antigen. After, we are going to see what we call diffusion. The diffusion is, as you can see here, the diffusion is a circle which is made when the antibodies and the antigen are binding together, and these size are going to be measured. As I explained, we are going to measure the diameter of the precipitate ring. So we are going to measure this ring, and the length is going to be equal to the concentration of antigen. Then if the ring is small, it means the concentration of antigen is also small, and if the ring is big, it means the concentration of antigen is also big. Then what is the principle of ELISA technique? This question is going to be my last question. I'm going to end up with it. So, enzyme-linked immunosorbent assay, which means ELISA, is a widely used immunoassay that detects and quantifies antigen or antibody in the sample based on their ability to bind to specific antibody or antigen. The step of ELISA involve coating, where a solid phase is coated with an antigen or antibody, depending on whether detecting an antigen or antibody. The binding, the sample is added to the well and the target bind to the coated antibody or antigen. The detection, a secondary antibody linked to an enzyme is added. The antibody binds to the bound antigen or antibody sample. Substrate addition. A substrate specific to the enzyme is added. The enzyme converts the substrate into a detectable product, usually producing a color change. And quantification. The intensity of color change is measured using a spectrophotometer, which is directly proportional to the amount of antigen or antibody in the sample. Then in this ELISA technique, as we can see, we have different types, but in to talk in general, ELISA technique is a technique where we are going to detect whether an antigen or an antibody, but in case where we are going to detect an antigen, we are going to add an antibody on the in the sample. We are going to add an antibody in the sample, which antibody will be binded with an enzyme, with be binded in with an enzyme. After, if there is the presence of the antigen and the antigen and antibody are binding together, we are going to add a substrate. The substrate is going to react with the enzyme on the antibody, which is going to make a color change. If there is no binding between antigen and antibody, the substrate is not going to react with the enzyme because the enzyme is not bind with the antigen. And then, in case where the antigen and antibody are binding, when we adding subtract, the subtract is going to react with the enzyme, which is mean that the antibody and the antigen are binding together. Then after, we are going to quantify this with a spectrophotometer to to have the measurement, the quantity of antigen which is among the sample. Thank you. I have done my video.